Hello, and welcome to the first COVID-19 video update from Whatcom County Health Department. I'm Brittany Fuentes, a public health nurse with the department. These updates will cover local COVID-19 disease activity and other new developments. More details are available in our weekly COVID-19 update newsflash. First, let's answer some common questions from this week. Kids are back in school, and with our high levels of community transmission, we're starting to see cases in the schools as expected. The school districts are taking the lead on guiding families through testing and quarantining. If you have questions, please contact your school district. We've also gotten questions about COVID-19 boosters. We expect to have more guidance in the next 7 to 10 days from federal agencies. Now, onto the data. These updates focus on data through last Saturday, September 11th. We have to wait for complete data from a variety of sources, so our data reports will always cover the previous week. Our cases leveled off for the first time since the surge began in July, but our cases are still very high. Early in this reporting week, we saw Whatcom County's highest 14-day case rate ever, higher even than last winter's peak. The case rate among unvaccinated residents is 5 times higher than among vaccinated residents. In total, 76% of all cases in Whatcom County last week were among unvaccinated residents. The hospitalization rate has also increased steadily since July. The share of hospital beds taken up by younger people has increased significantly. Unvaccinated people between the ages of 12 and 49 are 30 times more likely to require hospitalization than vaccinated people of the same age. Sadly, we lost 5 more residents to the virus last week. 2 of the people who died, a woman in her 80s and a man in his 70s, were unvaccinated. The remaining 3, 2 men and 1 woman in their 90s, were vaccinated. Please remember that more than 75% of Whatcom residents ages 65 and older are fully vaccinated. Although absolute numbers of death may be similar to those of unvaccinated people, the death rate is much higher among unvaccinated people in this age group. Death rates are measured by comparing the number of deaths relative to the population size. Statewide, unvaccinated people 65 and older are 8 times more likely to die from COVID-19 than vaccinated people the same age. COVID-19 vaccines are very effective at preventing infection, hospitalization, severe illness, and death. About 3/4 of everyone in Whatcom County who's 12 or older has started vaccination, and more than 67% are fully vaccinated. If you have more questions about vaccination, testing, data, isolation, quarantine, or anything else related to COVID-19, you can find answers at whatcomcounty.us/COVID. Thanks for watching, and we'll see you next time.